The first survey that I'm the author of is a survey that was sponsored by Newell because they're very interested in helping women, particularly as women age, in enhancing their sexual lives. So this was a survey of over 500 women who were between the ages of 40 and 75, looking at what sexual concerns they had. And how important was sexuality to their lives, and what impact did these sexual concerns have on their sexual lives. This was an incredible survey because we got a lot of feedback from these women and they gave us a lot of information. One important take-home point, I think, for your audience is that these women absolutely think that sexuality as they age is important. It is not necessarily the key ingredient to a healthy, happy relationship, but sexuality in and of itself was important to them. So even though they had some sexual problems, they would say that it wasn't the factor that would sort of distract them from a healthy relationship, but believe me, they want to be able to talk about their sexual concerns and they want to address it, and they had two major sexual problems. One is loss of sexual desire, and the other was pain related to vulvovaginal atrophy. Vulvovaginal atrophy related to the loss of estrogen really is about the loss of superficial cells and the thin, drying vagina and vulva that creates often pain, dryness, difficulty with penetration. So these women really don't know how to address it. They're not talking to their clinicians about it. If they are, they sort of bring it up as they're feeling dry down there. And so it's really so much easier for the clinician to bring it up, to say most postmenopausal women will experience some changes vaginally or in the vulva as they age, particularly if they're not taking any hormone therapy. What we know is that we have safe and effective treatments. We have local estrogen, we have aspemifene that can easily and effectively treat vulvovaginal atrophy. Yet, despite the fact, so we have about 64 million postmenopausal women, about 32 million of them have vulvovaginal atrophy because it's at least 50%. Women don't know, by the way, that unlike hot flashes, this does not go away with time. It only gets progressively worse. But 32 million women suffering, and 7% are using prescription therapies. So there's a huge disconnect because we can treat them with safe and effective treatments, but we are not. So it is up to the clinician to open the door and to educate women. One of the things from the other survey that I published, which was the Empower survey, which was about 1,800 women, again with vulvovaginal symptoms over the age of 45, they had talked about the fact that if their clinician had explained treatments to them, if they learned about the risk benefits, they would be much more likely to have tried something. And so very few of them had their clinician talk to them at all, and when they did, they didn't really have good education. And what they said they wanted was reading material from their doctor. They wanted to be referred to websites like the NAMS website or respected scientific websites that they could trust, and that's how they would be educated about the information so that they could feel like they were making an informed choice.